Well, great to see everyone. Thank you for joining and thank you for being here for our Healthy Mom Strong Baby series. My name is Stacy Stewart and very excited to be with you all today for this exciting conversation. This is our episode of Healthy Mom Strong Babies. And I'm excited about this episode because we so often talk about pregnancy and a lot of things that happen before a woman is pregnant, during her pregnancy, at the time of childbirth. But I think we don't spend enough time talking about what we call the fourth trimester, what happens to mom postpartum, and all the things that a new mom ought to be focused on. Certainly, she's focused on her baby and wellness visits for the baby, which is all of what she should be doing and the family should be doing. But today is really more about talking about what a mother experiences once she's had the baby, what her body is going through, mentally, what she's going through, emotionally, what she's going through. And what are some of the warning signs? What are some of the things that a new mom ought to be looking out for to manage her own health and making sure that she gets proper postpartum care? You know, one of the things that we don't often think about with respect to the maternal mortality uh, issue that we have in this country is the fact that actually a significant number of maternal mortality cases actually happen during the postpartum phase. And it's really important that we don't forget that women need care through all of that journey, before pregnancy, during childbirth, and after the baby comes, and in between pregnancies as well, which is really important. So that's what we're going to be talking about today, and really making sure that you get the information that you need. And obviously, as usual, on Facebook, if you're listening, please include a question in the chat. We can take your questions. We can get those questions answered as soon as possible. And we hope to make sure to address all of your particular concerns. We today have an amazing group of panelists I'm going to introduce in 1 second. I want to make sure that you also know we have resources that will be made available to you. One resource I want to mention to you that's specific to the fourth trimester is the CDC's Hear Her campaign, which is a really great campaign to make sure that healthcare professionals we are listening and responding to the needs of women to prevent any cases of severe illness or even worse in the postpartum stage, so that women get the care that they need. And we'll be giving out some more resources throughout the session at the end as well. So I want to jump into it and introduce our panelists. So excited to have them. First, I want to introduce Dr. Cindy Selleck, who's a board certified OBGYN. She's Chief Medical Officer of the Women's Hospital of Texas. She and her hospital are great partners of the March Dimes. At her hospital, the Women's Hospital of Texas, there are over 11,000 deliveries every single year, probably one of the most active baby hospitals in the entire country. So we're happy to have Dr. Selnick with us. Dr. Tracy Agnese is the baby doc mama, and we are so excited that she's joined us. She's a general pediatrician at Pediatric and Adolescent Medicine in New York City, as well as an IBCLC lactation consultant. And we're going to be talking a lot about both breastfeeding and lactation concerns, as well as some of the issues with the baby formula shortage that all of us are so concerned about. Next, we have Sasha Mayer, who is the Chief Executive Officer and co-founder of Mamabot. If you've ever gone to an airport or some big place where you need to breastfeed and you see those beautiful Mamabot pods, that's Sasha's work, and we're so grateful to her and the work she's doing at Mamabot to create these freestanding lactation spaces for breastfeeding on the go. So Sasha, thanks for joining. And then last but not least, we have actually a pretty regular guest now. Dr. Pooja Lakshman is a board certified psychiatrist specializing in women's mental health. She has been with us in previous sessions of Healthy Mom Strong Babies. She is the founder and CEO of Gemma, which is the first digital education platform focused exclusively on women's mental health, centering impact and equity, built by physicians. So we're certainly happy to have Dr. Pooja with us. And I'm just going to get going with the conversation. I'm going to first start with Dr. Selnick. Again, Dr. Selnick, thanks for joining. Your work with HCA Healthcare is amazing. One of the things that we want to just start with is just a framing of some of the signs, the warning signs, some of the things that happen in postpartum for women that women ought to be looking out for, whether it's around their physical health or mental health? What are some of the conditions, the warning signs, some of the issues that women need to be alerted to and be aware of once the baby arrives? And Dr. Selnick, you may need to come off mute. Sure.
How
There
about
you
now?
go. Yeah, we can hear
Thank
you
you for
now.
saying that. Happened without my knowing it, but thank you so much for having me. It is my pleasure to be here, and I am so excited to talk about this critically important topic because I couldn't agree more that we don't focus enough on it. You know, it's an incredibly joyous time in our lives after we deliver our baby, but it's also an incredibly stressful time where you're sleep deprived and trying to breastfeed and trying to recover from birth. And all the while, your body is going through a lot of changes, pretty significant changes that put you at higher risk for certain things, like preeclampsia, postpartum hemorrhage, blood clots, et cetera. And so what you need to know are the signs to look for. And the things that we tell people in the office most often to look for are excessive bleeding. We expect that women will have some bleeding, actually for up to an average of 6 weeks following delivery, but that should be tapering off over time and not excessive. We define excessive as bleeding more than 1 pad an hour. So if you're seeing that, please tell your provider. The other things we want to know about are any signs of infection, such as fever, or if you see redness, hot, swelling, for example, on your breast or abnormal discharge, we want to know about that too. In addition, headaches that are new, severe, not responsive to medications, definitely want to know about those. In addition to signs of depression and anxiety, which are common after delivery and can be very important for us to help you with.
That's great. And one of the things that we'll come back to, Dr. Selnick, because there's a lot there, but one of the things that March Dimes and HCA have worked on together are these videos, very short patient education videos, helping women who are being discharged have a better understanding of some of these warning signs. One of them, one of the issues that we're very concerned about is around preeclampsia, which is dangerously high blood pressure during or after pregnancy. And we created a video specific to that issue. Given that it's Preeclampsia Awareness Month, we thought we'd just show you a quick clip of that video. So if we could show the video.
You've just given birth and your body has gone through lots of changes. Now it's time to take good care of yourself so that you can recover. I'm Dr. Jaquiba Henderson, and I'm going to review some important information that you and the people supporting your recovery need to know before you go home. Most of the time, moms recover after birth with no complications. However, you should be aware of a few serious and sometimes life-threatening complications. Part of taking good care of yourself is knowing warning signs to look out for. In this video, you'll learn about signs and symptoms to be aware of and when to consult with your physician or go to the emergency room. Remembering the signs and symptoms in this video could save your life. High blood pressure puts extra stress on your heart and kidneys and can lead to heart disease, kidney disease, or stroke. Preeclampsia is a kind of high blood pressure that can happen during pregnancy or up to 6 weeks after giving birth. It can be very dangerous and can lead to serious health problems if not treated. Seek medical attention right away by calling your doctor or 911 or going to an emergency room if you experience the warning symptoms of postpartum preeclampsia. These symptoms include a headache that doesn't go away, changes in vision like blurriness, flashing lights, seeing spots, or being sensitive to light, swelling in your face or hands, gaining weight rapidly, severe nausea or vomiting, pain in your belly, most likely on the right side, under your ribs, trouble breathing or difficulty peeing. Sometimes postpartum preeclampsia happens without you noticing any symptoms, so your postpartum checkups are very important. Remembering the signs and symptoms in this video could save your life. After giving birth, You need to allow yourself time to recover, both physically and emotionally. Your family, friends, and providers care about you and want you to have a healthy recovery. Don't ever hesitate to reach out for help. You know your body best. If something just doesn't feel right, let your provider know. If you have any of the warning signs mentioned in this video, seek medical attention right away by calling your provider or 911 or going to an emergency room. Be sure to let them know you recently gave birth. One last important reminder: schedule your postpartum checkups before you leave the hospital. We want to make sure that you're recovering as expected, so go to all of your postpartum checkups, even if you feel fine. We wish you a safe recovery. Please consult with your healthcare provider for any questions or concerns.
So that was our interim chief medical and health officer, Dr. Shakiba Henderson. That was amazing. Beautifully done. I'm really proud of the work that our team did with HCA. So thank you, Dr. Selnick, for that. And again, we'll come back to you. I want to try to turn it to Dr. Tracy. We're on a first name basis here, I guess.
Perfect.
Make it easier.
Definitely.
So you're known as the baby doc mama on social media, and just give, but you're a pediatrician as opposed to an OBGYN. Tell us what some of the questions are that come up for you from new moms, whether it's around their babies, but even more importantly, what are you hearing from new moms that is about their own health? And then I want to ask you later about some of the things around lactation and breastfeeding
Sure.
and all of that.
Sure, yeah, thanks for having me. I'm so excited to be here. So I am a practicing pediatrician in New York City, new moms never ask about themselves. They only ask about their babies. They're very focused on their babies. Is their baby doing okay? They very, very rarely ask about themselves. When they do, it's usually something I say, call your doctor right now. It's like they're thinking they should wait. And if they're asking at their baby's appointment about something that's concerning them, I'm usually just concerned by that fact. So they rarely ask about themselves. And even when I'm giving lactation advice, oftentimes I have to give it in the way of, this is best for your baby. You know, if I tell her to relax and sit back and lean back and do all the things, she won't listen to me until I say, no, actually your baby will get the milk better if you do this, you know? So they really are focused on their babies, which I give, you know, a lot of education on, but I love to, you know, center it around them taking care of themselves too. So to answer your question as what kind of common questions do they ask? Most of the time it's stuff like, is this normal? Or is it okay if my baby's doing this? You know, most of the things are very normal, but babies are not just mini adults. They're completely different beings. And so if most people haven't had a lot of experience around babies before, so most of their stuff is just like, is it normal? Is it normal that my baby has, you know, congestion in the nose and is sneezing a lot? Yes. Is it normal that my baby turns to the side in the crib, you know, in the beginning? Yes. Is it normal that my baby's crying a lot? Is it normal that my baby has hiccups? Is it normal that my baby's poops are watery and seem like diarrhea? You know, but all these things that are really normal baby things is mostly what they're asking about.
Yeah. And just before we go to Sasha, in terms of your work as a lactation consultant, what are some of the common challenges that you find women experience as a result of trying to attempt to breastfeed, especially in those first early days?
Breastfeeding is hard. I think that and the reason I even became a lactation consultant is because I just was so unprepared for having a baby my first time around. You know, I'm a doctor, I'm a pediatrician, I did medical school, I did pediatrics residency. None of that taught me how to breastfeed a baby. And some of it too, I think a lot of it's our culture. We just don't see it. We're not around it a lot. And also a lot of it is, you know, preparation is good, but you can read till you're blue in the face about all the different positions, but it's kind of like swimming or riding a bike. Until you actually do it, you don't know what you're doing. So you just kind of have to do it. And then I think a lot of moms just get this, they get a lot of pressure, they get a lot of fear that they're doing it wrong. And then literally physically their bodies tense up and stop making milk because of that. So a lot of it is just really empowering the new mom that she and her baby can do it, that it's not natural, exactly, that it's a learning process, that it's a learning process for both mom and baby, and to seek all the support that she can in the beginning if she wants to make it work, because doing it just by yourself in a closed room with your baby rarely works out.
That's great. And Sasha, I want to turn it to you. Obviously, starting Mama with these amazing lactation pods is such a unique and so needed advancement in terms of really encouraging and providing safe and comfortable places for women to breastfeed. What got you started on that journey of Mamava, and what is it about the culture of breastfeeding that you've been attempting to shift with respect to the work you're doing?
Yeah, so I definitely came at it from a designer perspective. When you think about this fundamental human function that like it is, there's so little design around it. So I'm so happy that we're also talking about this mom orientation, this fourth trimester, because we hear about, you know, baby friendly, and we so often don't hear about mama or parent friendly. So came from it from my own experience as a business lady traveling and wanting to breastfeed. And when I was away from my baby, I had to figure out a place to do that. And it was often a restroom because you're disrobing, you have to be sort of in the headspace to do it. And obviously the wrong place to be making food for a new human. So, you know, what we think about is the world to be designed better for breastfeeding people, and and often babies. So sometimes a baby's distracted and just needs that place, and it's just not about the mom. A location in an airport it's pretty hard to find a spot, you know, even if you are the most comfortable breastfeeding mother. Sometimes it's the baby who actually needs that place that they can just settle in and be successful. So we actually are focused on employers because we feel like in order for parents to continue on their breastfeeding journey, that's a big hurdle, is returning to work. And unfortunately in this country, with so many people returning to work so soon after delivery, that's a big focus for our company. And although you might see our units in public places, it's mostly actually in private employers that we're making the biggest impact.
That's so great. Well, we appreciate it. And you're right. Those for working moms in particular, having those places both for them and the baby, to have a quiet, you know, place that's comfortable for everybody is really important. So thank you for that. And Pooja, I want to talk, you know, we talk a lot about the physical health of moms. And obviously we don't do enough in this country for mental health overall. Today happens to be a big mental health action day. We're partnering with MTV and thousands of other organizations to raise awareness around the needs of mental health overall. But we're also working very, very hard on the issues of maternal mental health. And Pooja, that's what you're focused on. So talk to us about why it's so important, and what should women be looking for with respect to whether or not they may need help with respect to their mental health postpartum.
Yeah, absolutely. It's a great question, and I'm really excited to be here with all of you having this conversation. I think before, or perhaps it related to the mental health question, I just want to early on speak to what's going on with the formula crisis right now, because I do think that there's a direct link there. And I know that, you know, we'll hear more from Tracy on this, but the whole fourth trimester journey for a mother is one that really is an emotional roller coaster. And when it comes to whether it's the process of breastfeeding, or it's the process of pumping, or it's the process of figuring out how to feed your baby with formula, all of it is hard. And then of course there's the sleep issue, that you're sleep deprived and that you're trying to figure out how to get this new human being to sleep, which is its own stressful process. Everything about it has a huge learning curve. And it's really helpful kind of to hear from Tracy in regard to those pediatrician visits where moms really aren't thinking about themselves, right? Because you're tasked with really focusing on this vulnerable little being that you're completely responsible for. And I think that's why it's so important that we reframe that postpartum period to be really actually about the dyad. It's about you and the baby. I recently just wrote a piece for the New York Times about my own, so I'm actually in my third trimester right now, and soon will be in my fourth trimester, and kind of all of the decisions.
Congratulations.
Thank you. That I made personally as a perinatal psychiatrist. So I preemptively am taking actually antidepressant medication because I have a history of depression and anxiety. And we know that that is one decision, if you're high risk, that can reduce your own risk for postpartum depression, postpartum anxiety. The other evidence-based strategy is sleep prevention or sleep protection. So I am fortunate and privileged to be able to have a postpartum doula that will be able to help at night. All of this, of course, requires resources. So, ultimately, we're talking again about the systems and the systems we live in and how so many folks are left behind if you don't have a supportive employer, if you don't have health insurance, if you don't have paid leave. But so there's a lot that you can do on the prevention side. I would say on kind of the warning sign side, the things to look out for are changes to basically, what we call the baby blues is normal. So that's something that will come up usually in the first couple days after you deliver. That's related to the big drop in estrogen that happens. And that is sort of feeling like an emotional roller coaster. You might be crying one second, you might be furious at your partner the next second. There's not really a rhyme or reason. That usually gets better on its own. It doesn't require treatment. It shouldn't last more than about 3 to 4 weeks. However, if it's getting worse over those 3 to 4 weeks, and if you're kind of 6 to 8 weeks out and you're still feeling that way, that could be a sign that this could be something clinical like postpartum depression, postpartum anxiety. The other thing to look out for is not being able to experience any positive emotions towards your baby or towards your family. While it is completely normal to have periods of being, stressed, sad, grieving your old life, all of that is totally normal. You should still have some moments of feeling of connection and joy and love, even if those are fewer and far between because you're sleep deprived. But when you don't have any of those moments, that's also another time to reach out to your provider. And then the last thing, and then I'll stop talking, is please make sure, you don't have to wait till that 6-week checkup to reach out to your OB. Bring it up with your pediatrician if you're there for the well child checks. Send a message through your OB or your midwife's portal. They would rather hear from you early. And usually you can do a telemedicine visit versus wait until 6 weeks to find out that things are really kind of going off the rails.
No, it's really great. And Tracy, I'll turn it to you because I do think we do want to talk about this baby formula issue that we're all seeing. Some of us are directly experiencing. And we actually did get a question from Facebook. The question is, what about, and this is a slightly different from the shortage issue, but it's still formula related. What support is available? What about support in learning about baby formula in general? 2 months into the NICU, I left without even knowing how to find the right formula, much less how to know how much to give. So I guess there's a lot of information. There's some information gaps. So how do people, especially women, families in the NICU, how should they go about reaching out and finding out those questions and answers to those questions, especially about formula and not only where it's available right now, but even how much to give a baby, especially if a baby is born with some challenges?
Yeah. I mean, good question there. So first of all, I think this whole formula thing is a big just failure of our system, of prioritizing moms and babies, because this is, in 2022, it's just shocking that this is happening. And formula is, breast is best is what we hear a lot, and breastfeeding is great, but formula is also great for your baby. They're both great. A fed baby is great. And there's a lot of data on why breast milk is great and why it's so much better than formula. Some of it is good and okay, but some of it is a little maybe overpronounced, and formula is totally fine and a great way to feed your baby. So I just want to say that because I just feel over and over that new moms are, new parents, all of them are, often really feeling a lot of shame and guilt about it. And they should not be at all. If you're feeding your baby anyway, no matter what, you're doing a great job. So to answer the question about how to find out information. So first of all, I think maybe this baby formula crisis right now will shed light onto the fact that a lot of the baby formula industry is, and I've been saying this for years, really just meant to confuse new parents and to make them feel like they need to buy something different or more of something or try all these different things just to spend more money. And we're really seeing it now that this is what's happening, because the bottom line is that there's so many different types and brands. We'll start, and what I mean by types and brands, I guess I'll say a little more about. So when I talk about brands, of course, it can be the regular popular brands, Similac, Enfamil, a million others, but also generics. Generics are all great and fine. So whatever store you have, whether that's online or in person, and they have a generic version, buy that. It's a lot cheaper. And the infant formula in the United States is actually very, very heavily regulated. So therefore they have to comply with the FDA list of ingredients. And so it's really all very, 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 very similar. So anything that you can find, whatever type of generic or brand name, is really fine. And then when I talk about types, again, this is all about, a lot of it is marketing confusion. Yes, there are instances where some babies for medical reasons need to be on very specialized formulas, whether that's extensively hydrolyzed and amino acid types and all this stuff. And I would hope that if your baby is on that you've gotten some education from wherever you were, about what type your baby needs and why. But most babies, most healthy babies, full-term healthy babies, or even not full-term, but most healthy babies can be on various different types. So there's the standard cow's milk formula that most of the brands have as their generic version, but they're always changing the names on it and adding a pro and adding something that makes it sound like it's fancier and better, and it's really all the same stuff. That's the standard one. Then there's the oftentimes they'll call it gentle or soothing, and believe it or not, they actually mean different things, which is also crazy, right? Gentle usually means they have broken down milk proteins, not like extensively chop broken that the specialized formulas are, but just like a little more chopped up, like less, maybe a little more gentle. And then there's ones where they call soothing, which often is lactose free. Very few babies medically actually ever need lactose free. Some do, but for the most part, it's just another marketing thing to make you think that this is gentler or is more soothing for your baby. And then there's soy-based formulas as well, which is just really most of the time without a medical need is really just a choice, because it's hard to feed a baby. It's hard to know what. Babies are only eating and pooping and sleeping in the first few months of life. So if they're crying or there's something that you don't understand about babies because they don't really tell us what's going on, you just assume it has to do with their eating or how they're pooping, because that's really all they're doing. So I don't know. I think it's there's a lot of confusion, but I wish there wasn't, and there doesn't have to be. And as far as like how to know how much to feed your baby, usually, I can't say what's right for every baby at every age, at every meal, because we're all different, and so are babies, right? So every baby at a week or two might be a little different. And quite honestly, even like during the time of the day and certain days, just like you and I, sometimes we're hungrier than we are at other times. Sometimes we finish our plate, sometimes we don't. So the best thing that I usually like to, again, it's like empowering the new parent to know that you're not doing it wrong, and that like you can do this, and just start to learn your baby's cues from the beginning. What does your baby do that makes your baby, that tells you that your baby's hungry and wants more? What does your baby do that your baby is giving you a sign that they're done? And there's a lot more to that, but I mean, that's really the general gist. It's not going to be every baby at 2 weeks is going to eat 2 ounces every 3.2 hours and that's it. It's not like that.
Right.
But
So
I think
stay connected. Stay
Yeah.
connected with your neonatologist if you're in the NICU, your pediatrician.
Right, and go in for
because
those
all
frequent checks, because then
Yes.
we're going to be monitoring how your baby is growing.
Yes.
And
Right.
that's really one of the biggest factors, is if what you're doing is allowing your baby to grow and develop properly, then you're doing a great job. And if you're
Right.
ever unsure, schedule an appointment with your baby's doctor and say, I don't know if the baby's feeding enough right now. Let's check in on weight and growth. They'd be more than happy to do that.
Yeah. Also, just a little plug for the Marchidontists. We have a ton of information, especially for for families who've had their babies in the NICU. So feel free to always
Mhm.
visit our website at marchdowns.org. In about over 60 hospitals, we have NICU family support programs with staff to help answer questions and connect women and families and moms with the resources they need. So I just wanted to put that out there too. Dr. Selnick, I wanted to ask you, just to get back to this overall health issue for women. I mean, I think the point that was raised earlier is that a lot of women, and Dr. Tracy mentioned this, are not focused on themselves. They're focused on their babies postpartum. What do you advise? I mean, how do you urge and encourage women to spend some time, even though it's hard? They may be busy. Some women have to go back to work. Some women may not have all the support at home that they need, and so a lot of the burden of raising the baby and feeding the baby and taking care of the baby 24/7 falls on them. I mean, how do you navigate that with a woman that's really, frankly, struggling with, the resources and support to make sure that she can really prioritize herself while she's also prioritizing her baby as well?
Yeah, that's a great question, and it's challenging. And I think we have to make sure we're individualizing healthcare systems, healthcare providers. We need to individualize how we're approaching this with each patient, because there is not a one size fits all. First of all, we need to be talking about it in the prenatal visits. So talking about contraception, talking about support at home, domestic violence, cigarette use, all of that should be included in the prenatal care. And then postpartum, we used to say 4 to 6 weeks is when we need to see you, and it was a checkbox. 40% of people don't even show up for those. So ACOG, the American College of Obstetrics and Gynecologists, pivoted and said, let's do this differently. And I like this approach, and this is one way I think we can help. We can help women by empowering them and saying, let's have a touch point at 3 weeks. And this is what ACOG endorses as well. And it can be by the phone, it can be in person, but that should be a visit where you can start talking about following up anything that had been going on in the pregnancy. You can talk about things that are happening acutely. It's a way to stay connected to the patient and then individualize what you need to go do going forward. At 12 weeks, obviously, if you haven't had it by that point, you need a comprehensive visit, which goes over everything physically and mentally. But that would be, I love the approach the American College of Gynecologists takes, and I think it can help protect our patients. Of course, I'll just mention one other thing, and that is this is for the average patient. Again, you have to individualize. If a patient had elevated blood pressure in the pregnancy, they're going to need to be seen sooner. If they have other risk factors, they may need to be seen sooner as well. But what I was describing was the average patient.
Yeah.
And if it's okay for me to jump in too, I'd also love to just, from the kind of psychological side or behavioral side, one of the things I see so often with my patients is the resistance and reluctance to accept help. Really for many women, having a baby is the first time in your life where you really cannot do it alone. And so often I see with my patients, like, oh, our friends offered to make a meal train for us postpartum, but we don't need that. That's okay. I don't want to inconvenience anybody. And
Yes, you do.
right, exactly. It's just say yes to every single offer of help. And I know that will kind of go against all of your conditioning and everything that you've learned as a woman. But this is the time to really to accept it. And so, for example, like with the prenatal visits, if you have a toddler at home, that might mean that you need some help with childcare, so being able to kind of think ahead and really sort of like lean on your support system. The other piece that I'll say is that actually there's a ton of research that shows that the helpers, the people that are helping you, also get benefit from being your support system. It strengthens those interpersonal relationships. It brings meaning to our lives. So it's not selfish of you to be accepting this help from your community. It actually strengthens the bonds for everybody.
I think that's so true. And Sasha, I wanted to just turn to you because, I think this idea that part of why are in this baby formula challenge that we're in is because we don't prioritize the needs of moms and babies, and make sure that moms are a priority in our society. Where we are on paid family leave is a good example. Where we are on dropping some women from Medicaid 6 weeks after the baby arrives, and so then they don't have the coverage to go for extended visits if they need, whether it's to see a psychiatrist or psychologist or a therapist, or continue visits with their physician. It sounds like your founding of Mamava was sort of rooted in that as well. That what you saw were gaps in providing the kind of care that moms and families need. And what else are you learning about some of those gaps in the course of you growing your business?
Yeah, what I think is really interesting is that it shouldn't be a class issue, but it is. And folks with paid parental leave, folks with resources and support systems, people who maybe even live near family who have breastfed in our world, they have those successes, and for us, creating an object that went into the world was about also starting a conversation, and the very intentional kind of way that our pods kind of stand out. And we have a logo that we call the Happy Breast logo. It was always not just about that end user, that parent who was pumping or breastfeeding, but it was about making it easy for facilities to create spaces for lactation, and then also having a dialogue in culture, right? Because it was so hidden, again, this fundamental thing that sustains human life, but so invisible for people. And this difficult time with the formula is, again, it percolates it up. It is a systemic problem. There are people who are in surrogacy or adoption, or who whose bodies can't make breast milk, but there are also plenty who there is just literally no infrastructure and support for them to actually have that be an authentic choice. And that's what we work on every day. And it's especially interesting in the healthcare field when I hear about Dr. Selnick's, having 11,000 births. Oh my goodness. Within the hospital system. And you think about all of those folks who are employees, and we know how complicated hospitals are in terms of lack of space, lack of kind of management of your time. And we often hear from healthcare professionals where they are, in a baby-friendly hospital, teaching about lactation, supporting their patients, but they themselves don't have the time, space, support, infrastructure to actually be successful in breastfeeding. So lots of work to be done, but it, the silver lining is that these conversations are being had, and we are and that the fact that we're all here having this conversation. And I love this idea of that fourth trimester and breastfeeding is almost something you do for yourself. I had never thought about it that way, that this is this is a moment that it's not about taking care of the baby, but positioning it as actually taking care of yourself is really interesting, because we know actually the health outcomes when a parent can breastfeed are actually more meaningful for the parent, for the mother, than maybe even for the baby, as far as the research shows. So this is so helpful to me to hear you all and your expertise in terms of how we can continue to talk about it. Thank you.
One of the things, Pooja, you said about never turning down offers of support. Are there what is the support that's really most needed for moms, and what support should they be either asking for or willing to accept? And also, what is the support? Maybe this is for any one of you to chime in as well. What is the support that's really not helpful sometimes? I mean, what can we tell workers and friends and coworkers not to do during the postpartum period to help new moms?
Yeah, so I think for the first question, sort of, I think of support in two kind of buckets. One is just the tangible, the tactical the person that's going to be there that is, helping you bring the baby home, helping with childcare issues, helping you pick out the car seat, whatever all of those sort of logistical things are. That's kind of like your operations help. And that is people that have that type of operations help, whether it's from a partner, whether it's from a grandparent, whether it's from a close friend or colleague, they tend to have better outcomes actually in terms of prevention of perinatal mood and anxiety disorders, and then also in terms of severity if they do have a perinatal mood or anxiety disorder. But then on the other side of things, the emotional support is also just as important. So having that tribe, and it could even just be one or two other friends who have been through it and are non-judgmental, are just there to hear you, that you can call when you're having a rough night in the middle of the night, baby won't stop crying, or maybe, breastfeeding isn't working out and you're just feeling a lot of guilt and shame and you need somebody else to be there with you who understands. That type of reassurance and non-judgmental acceptance is also actually protective. Even though it sounds quite intangible, we know from the research that it actually is people that have those relationships in their lives are able to, are more protected. So those are the two things. And then on the last question, I'd love to hear from other folks too, but one of my pet peeves is sort of like the unsolicited advice.
Mm-hmm.
The people who sort of have all the answers, and being pregnant and becoming a parent, it seems like it's an invitation for everybody to give you all of their tips. And we don't need more information. There's already a ton of information on the internet. So I think if someone's not asking you for specific advice, keep it to yourself.
That's great. I'd love to add, Pooja, I want to echo all of that. I think it's awesome. And I'm always telling new parents too, because they're so overwhelmed by it. And I usually tell them, pick one or two people that you trust and you want to listen to, and, listen to their advice and just ignore all the rest, because it can be very overwhelming. And I think, our culture here now, we do really, we kind of have this reverence for the pregnant woman, and we literally open doors and we, give her a seat on the subway and we do all these things. And then she has the baby, and oftentimes then she becomes chopped liver, and the baby is what everyone is focused on. When can I come meet the baby, visit the baby, and whatever. So just as a gathering right here of everyone who's really here to support new parents is just, the baby's not going to remember, the baby doesn't need you to visit, the baby's not going to remember that you showed up, but that new mom, the new parents, they're going to remember who showed up, and they're going to remember who helped. And so that can really look like, it can be really hard for women and people to accept that help in the beginning. They don't even really know how much they needed, or maybe they say, what can I do? And she can't even, she hasn't slept, she doesn't even honestly know what you can do. So just do things that, make sense depending on how close you are to them. Whether that's you show up with a plate of food, you say, what's your favorite takeout? You bring it over. I'm going to the store. What do you need? And you show up, and if you're, there's dishes in the sink that are dirty, wash those dishes. Just simple things, but, just do the things, just help, walk the dog, mow the lawn, whatever, just do the things, and they'll really appreciate it.
That's really
And
great.
I would add, there's one thing that I found that I had to do quite a bit, and it surprised me postpartum, and that was give women permission to take time for themselves. Women, they feel guilty.
Mm-hmm.
They don't want to leave the baby. They feel like that's their 24/7, 365 job. And we have to remember that, yes, you have a new baby, but you must take care of yourself. And so having a little bit of time, however you want to do that, to yourself is okay.
Mm-hmm.
You have
I think
permission
that's
to
right.
do that. And it's healthy for you.
Right. Well, on that note, we're going to end it. And I think that was a perfect way to make sure that, one of the things we say at the March Times is it starts with mom. So we have to prioritize her and every pregnant person and every new mom. So thank you all for joining. I just want to mention a few things before we leave. The March Times does so much great work. I'm really proud of our organization, proud of all the work we do in policy and advocacy. We have a lot going on to push for things that will support moms, especially in the postpartum stage. So if you want to be a part of advocating with us, to extend Medicaid postpartum. Medicaid covers 40% of all births in the country. It's a huge part of the support that new moms have in this country. And right now, far too many moms get dropped from Medicaid 2 months after having a baby. They need extended support and coverage and care. So please join us at March of Dimes with our March for Change events. Go to marchdimes.org/March for Change for more information. Another quick thing I want to mention is our maternal mental health hotline that we're working on with many different partners. There is now a new confidential toll-free hotline for expecting and new moms who are experiencing mental health challenges. Today is Mental Health Action Day, as I mentioned. There are hundreds of organizations that are part of raising the awareness around mental health. That includes maternal mental health. If you need help as a new mom, call 833-9-HELP-FOR-MOMS in both English and Spanish. And then lastly, I just want to mention, next week, we're having a military baby shower for military moms, because we can't forget that there are moms in the military as well, and they need a lot of support too. We're going to be having a virtual military baby shower next Wednesday, May 25th at 7 p.m. to address the unique needs of military families. It's such a great way to honor our service members and their families. So we certainly invite you to join there. If you need more information on a lot of things that were mentioned, a lot of our panelists are really active on social media. They have their own websites. Here are a bunch of sites that they have, ways to reach them. But we want to say thank you all for joining today. I want to say thank you all of our panelists. It's been a great session, and we look forward to seeing you at our next webinar as well. Thanks.